At the Royal London, the trauma doctors deal with everything from life and death injuries on the road to medical mysteries in the hospital.
We're going to go and see a young lady who's come in with quite a sort of sudden, dramatic onset of dizziness. Hi, I'm Simon Walsh, I'm consultant in A&E. So what actually happened to you today?
I was driving and just all of a sudden started feeling dizzy. I had to go to Sainsbury's, so I managed to park in Sainsbury's and I managed to get downstairs into the actual supermarket, and then I just felt really dizzy and lightheaded.
When you say you felt dizzy, just tell me exactly what you were seeing and feeling at that time.
I just felt like everything was moving around, that, you know, like if you come off of a merry-go-round when you're little.
There must be 30 or 40 different causes of dizziness. The most serious of those include things like brain tumours, bleeding within the brain, so it's quite tricky to know which way we're going with this.
So what I'd like to do is just examine you, just have a look in your eyes.
With so many possible causes for Annette's dizziness, Simon needs to find some clues fast.
I'm going to ask you to put your hands out in front of you to hold them steady. Take my hand, squeeze my fingers tight, and go back and forth as quick as you can. I'm going to move my finger to make it a bit more difficult as well. Okay, so a little bit unsteady there.
A little bit.
Okay. Just the reflex on the right knee jerk is just slightly reduced compared to the left side. Tell me if you see double at all. There are some subtle abnormal movements of your eyes when we do that. Yeah. Okay.
Yeah, it's like when you stop, all of a sudden I almost feel as if my eyes want to continue moving.
Right, yeah.
There is some slightly abnormal movement of her eyes. These could be caused by an abnormality of the middle ear or with part of the brain that deals with balance and coordination.
Have you got any family history of dizziness?
My mum had problems with her eyes, and she had to have a brain scan because they thought that there was problems with the nerves there, and then it came about that she had a large aneurysm there,
Okay.
which has been successfully coiled.
Okay.
Whilst my mum was waiting for the operation, her older sister actually had a stroke, and they found out that she had an aneurysm that actually burst. Another sister actually found out that she had an aneurysm.
Because of the history that you've got in the family, I think it's probably worth doing a CT scan. Okay, I'll see you in a little bit.
Yeah.
So we've got a couple of abnormal findings which don't particularly fit together in my mind to give me an answer, but there's enough to make me think I need to go looking a bit further for anything potentially serious.
When my mum found out she had the aneurysm, it was a complete shock to the whole family, because essentially, you know, when she found out that how big it was, she was told basically she's a ticking time bomb.
If you've got an aneurysm there, then it's best to know about it before it causes you any